Hello everyone, this is Dinah Menezes, one of the staffs working at MedCity International Academy. Today I am here in order to discuss that critical point which is very important during your writing task. That is nothing but comprehension of stimulus, which is one of the important one because it holds around 70% of your marks. Comprehension of stimulus, what do you mean by that? Stimulus, something which triggers an action. And in your case, it is the question paper which is in the form of the nurse's notes that you have to elaborate into proper sentences and write a letter to the reader of your letter. Now, then what do you mean by comprehension? Selection. So therefore, I've got a case notes here where I'll be teaching you how you have to select the data depending upon the profession of the reader of your letter as well as the purpose of your letter. So let's come to the board. Now today's writing task, we are going to write a letter by using this case notes to a dietitian about this patient's relevant social and medical histories to request a visit to conduct swallowing and nutritional assessment as the patient is at a high risk of aspiration. Now from the writing task, we can identify that the dietitian is the profession of the person to whom you are writing, and then conducting an assessment for swallowing and nutrition as well as for a high risk of aspiration is something which specifies the purpose of your letter. Now, depending on the profession and the purpose of your letter, let us read this case notes and select the case notes which is very important. Now, name of the patient, it's one of the important data. And then we have got new resident of dementia specific unit. Is this important? Yes, because this is talking about a medical history of the patient, and this you can include in the introduction. You can, for example, you can write the purpose of this letter is to request so and so thing to the above mentioned patient, a new resident of dementia specific unit. You can put it in the introduction. Yes, she is single. This is not something which is very important when you're talking about the risk of aspiration and to a dietitian. So we can remove this data. Now, under the Australian guardianship, there is no connection at all for the risk of aspiration. So therefore, again, we can delete this particular data. Now, medical history. All histories are not important, candidates. You have to see that which particular history is required to be sent to the dietitian. IHD, ischemic heart disease. The dietitian may require to give a cardiac diet to the patient. So it's a very important thing. The onset on the other hand is negligible, whereas NTG patch not at all because we are not writing for a physician. Stroke, onset not important. Unsteady gait not at all important because we are not writing for the physiotherapist nor we are writing for an occupational therapist. But stroke is important because the patient may lose his swallowing or the mastication function because of stroke. Onset of dementia, if you have already mentioned it in the introduction, then you don't require to repeat it because OET writing doesn't call you in order to repeat the data continuously. If you have not written there, then you can write about the dementia. Whereas the client is able to understand simple instructions is an important data because the dietitian will have a conversation with the client when he is coming for a visit. But then confusion and disorientation, you can remove it. Diabetes mellitus, very important data, and an important specific data is also regarding the diabetic diet because as the cardiac diet, the patient is supposed to be also on a diabetic diet. Osteoarthritis. Many people get confused because osteoarthritis is a case which is very important for an orthopedic surgeon or maybe when you're writing for a physiotherapist or an occupational therapist. But you have to also realize that the patient may require a calcium-rich diet. So therefore, it's an important information for the dietitian. Now about the gel, we don't require it. Weight gain. for the 10 kgs for the last 5 months. This is also an important data because the patient is overweight. No allergies to medication, not important. But then about the food, it's very important because the dietitian requires to know that is the patient allergic to certain food items. No teeth, wears dentures. That's very important because of this problem the patient requires a swallowing or the mastication assessment, and then if he refuses to wear it due to dementia, this is a very important data. Increased appetite, and patient eats 3 full meals, eat other residents' food, bananas, biscuits and lollies. This is something which is placed in order to confuse you. You don't require to write all these things. It may seem important, but then you can delete all these things and you can only say that the patient's appetite has been increased remarkably. Now let's move to the social history. Now as we are writing for the dietitian and the purpose of the letter is high risk of aspiration, knowing that the patient is not having friends, is it of any importance? No, it's not of any importance. Lacks interest in coloring and watching, this is not the purpose of our letter. You have to understand it. Then increase emotional dependence on nursing staff. A dietitian may not consider the emotional status of the patient. So non-smoker, non-alcoholic and illegal drugs, when he is not smoking, not drinking, not using, there is no point of writing it. So all these things are irrelevant data that are especially placed by the OET people in order to confuse you. You have to focus on these things so that these data should not confuse you. Now, recent nurses notes. Now this is something which is very important. Now 15.2, you can highlight here that we are talking about the February month, but then here when we are seeing, we have got the history of the March month. That means there is a gap of 1 month in between. So do you think all these data are very important? May not be. So let's come here. Chest infection, patient is already been treated with antibiotics for 7 days, and that also happened maybe before a month. It's not at all important. And then occasional cough, and there was shortness of breath with increased respiration rate. This is also not important because it had happened in the month of February. So on 27/2/2012, there is sporadic throat cleaning after eating yogurt. Now eating yogurt they have given in specific, but that doesn't mean that only by eating yogurt patient is having sporadic throat. It is just giving a sign that the patient is having a problem in gulping of the food or the swallowing of the food. So you don't require to write all these things in detail, but the very important data is the one that we are going to start with. That is something that happened today, that is nothing but on 20th March 2012. So here it's clearly saying that the patient had an episode of choking on a piece of food. This is a very important data. And then food not chewed properly. That means the patient is having problem in swallowing his food. And then suddenly the patient had turned cyanotic, turned blue, grabbed the throat with both hands and coughed. Food particle was removed. You don't require that the patient grab the throat and all these things. You can just say that on so and so date the patient had an episode of choking over his food, and then the patient suddenly turned cyanotic and the particular piece of food was removed. You can write like that. And then nursing assessment after treatment. So you can write, therefore the patient was provided treatment, but then you have to also see here that the pulse, BP, the respiration rate, the temperature and the BSL, all these things are basically normal except for the pulse. But then this is at 17:10 hours. That means after a gap of 10 minutes, isn't it? But then here you can also see that maybe after some 50 minutes Again, the patient has no complaints. That means it is totally under normal condition. And here 88, it has come to normal. So you don't require to write, because we are writing the letter after this particular thing. And then rest all things here are normal. Again, the patient's skin color has become normal. Hospital visit not required. So therefore, only these things. Then you can in brief say that, however, the patient's vitals were unremarkable. That means there were no significant changes. So you can compress all this data into one particular sentence, and this is how you have to select your case notes. Soon after the 5 minutes preparation, or after the 5 minutes reading time of yours is done, you shouldn't write. But as soon as they say that you can take your pencils and start writing, you have to select your case notes first, because planning and organizing and then writing the letter will surely give you a B grade. For more information, please do visit us at our branches which are there in Mangalore, Kottayam and Kannur. Thank you.